We are called to serve humanity.
What are your activities in this COVID-19 pandemic period?
I have been part and parcel of the COVID-19 pandemic activities in Hospital Management Board. Initially, when this COVID-19 pandemic came into Abuja, into FCT in general, the Minister of FCT set up several committees to pilot the activities that will bring about opening up of centers for the management of these COVID-19 patients. And then in the activities, as a director of nursing, we were to mobilize staff, volunteers, nurses who will volunteer for the activities. And then we made sure we encouraged them, and most of them volunteered to be part of the activities. And they are all they were trained for the COVID. And also as a director of nursing, I was also appointed to a committee, the FCT COVID-19 Accreditation Committee. This committee is responsible for looking at the facilities, all those facilities, both at the private and the public facilities, that want to be part of the facilities that they will nurse these COVID-19 patients. So we go to the facilities and accredit them. Those of them that meet the infection prevention control practices, we now recommend them to the management for them to be given approval to begin the services, to run services for the COVID-19 patients. So I was there in accreditation of Asokoro District Hospital. We were there for Karo General Hospital COVID Center. We also accredited the Idu COVID Center, and then the This Day Dome COVID Center. These are the centers that we have accredited. They are ready for services to commence in those areas. Some have commenced services, some are yet to commence services.
I believe you have words of encouragement for the generals in the field. What are your words of encouragement to support them as they are working?
I want to appreciate my nurses who have volunteered themselves to work in this war front. I look at COVID centers as war front. And as a war front, as a nurse, you are one of the frontline workers, the main frontline workers, health workers in these COVID centers. And most of them, they have left their families for almost 6 weeks now, 5 to 6 weeks. Once you are in the center, you volunteered yourself to be a part of the health workers nursing these patients. You're not to be with your family. You will be quartered in the hotel, and then until God knows when this COVID, if we're able to fight the COVID and the infection dies down and is curtailed, maybe some of them will go back to their families. We want to really, as a person, I want to really appreciate them for their efforts. Even for volunteering yourself to go to the war front, you don't know what is going to befall you. All you know is that God is there for you. You've trusted your life in the care of God as you take care of these patients. We want to really encourage them. We are praying for them. As generals, we are praying for them. God will protect them. God will guide them, give them wisdom. We keep encouraging them. We call them from time to time to encourage them. That make sure the words I always tell them. Use your PPEs very well. There's no hurry about the care of COVID patients. Keep yourself well. Do the things that you have been taught to do because they have been trained. Let them put into practice all that they have been trained. They should not be careless about themselves because they have to protect themselves before they protect others. If they go down with the infection, that's minus on our own part. We will need to mobilize more people to go in and look after these people. So all we encourage them is that they should do their best. Take care of the patients and also take care of themselves first, and then take care of the patients. We want to also really appreciate the management, HHS, the Minister of Federal Capital Territory, for all that he has been doing ever since this infection entered in Nigeria. He has been providing all the equipment that they need. If you go to most of these centers, everything that they need to work with are there. So we don't have any excuse. It is to use all that have been provided. We also thank the NGOs, philanthropists, private individuals who have really donated equipment for the fight of this COVID. We are really appreciative as nurses. And my nurses are also very appreciative to all of them. They have things to work with. Or we encourage them make use of those items, the PPEs that have been provided, and use them the way you're supposed to use them. And by so doing, they will not get this infection. And we are praying for them, that God will preserve their lives. And for the patients that they are caring for, that it won't be long. God will heal them, and they will all return back to their homes.
COVID-19 will soon go, by His grace. What are your post-COVID-19 activities, your plans?
Indeed, really after the COVID, we must begin now to think about what will be our plan of care once the COVID is over. We have been equipped knowledge-wise and equipment-wise. All these equipment that have been supplied for COVID, I'm sure when the COVID is over, it will become part of our hospitals. And then the government has laid down rules of the need to prevent infection. It's not only COVID. After COVID, there are still other infections. We need to still continue to put those practices into use. In our hospitals, the social distances. If you go to the hospital now, you see the way they put patients, the social distance is maintained. Infection control practices are also maintained. We plan to still carry on with this infection prevention practices so that we ourselves as nurses will not get down with the disease, and the patients will also not get down with it. The patients who are coming, who don't have infections, they will not contact infections. It is our role to protect them from getting that infection by maintaining the social distance, using all the infection prevention practices.
On behalf of NTNI TV, thank you. God bless you.
Thank you very much.
We are called to serve humanity.